Colon cancer is one of the most common cancers affecting several thousand people every year. Lack of regular physical activity. A diet low in fruit and vegetables. A low fiber and high fat diet. Or a diet high in processed meats. Being overweight and obese is the main cause of colon cancer. Of cancers that affect both men and women, colon cancer is the second leading cancer killer in the United States. Over 101,000 new cases of colon cancer are reported every year in the US. You must know about the early signs and symptoms of colon cancer. In this video, we'll talk about the most common signs of colon cancer. Changes in bowel habits. A change in bowel habits refers to a change in stool, meaning frequency, consistency, color, or how much control you have over when you move your bowels. Incontinence. Abnormal changes in the color of stool can include black, tarry stools, clay-colored stools. Changes in bowel habits include such as diarrhea, constipation, or narrowing of the stool that lasts for more than a few days. Changes in bowel habits may be signs of colon cancer. If you notice this bowel change habits, you need to talk to your doctor as soon as possible. Rectal bleeding, or blood in your stool. Rectal bleeding is a symptom of conditions like hemorrhoids, anal fissures, inflammatory bowel disease, IBD, ulcers, and colon cancer. Typically, you notice rectal bleeding on toilet paper, in the water of the toilet bowl, or in your stool. It goes dark red or black and can make your poo look like tar. This type of bleeding can be a sign of cancer higher up the bowel. Or it could be from a bleeding stomach ulcer, for example. It is important to go to your doctor if you have any bleeding and get checked. Stool that is dark in color. Black or tarry stools with a foul smell are a sign of a problem in the upper digestive tract. It most often indicates that there is bleeding in the stomach, small intestine, or right side of the colon. Black or tarry stools may be due to bleeding in the upper part of the GI, gastrointestinal tract, such as the esophagus, stomach, or the first part of the small intestine. In this case, stool could also look very dark, almost black, and tarry. This type of dark stools may be the symptoms of colon cancer. Unexplained weight loss. Unexplained weight loss is a decrease in body weight when you did not try to lose the weight on your own. If you have an unexplained weight loss, it could be a sign of colon cancer. It can cause weight loss for several reasons, including nausea, vomiting, and an inability to eat. If you have lost weight without trying and have any of the other signs or symptoms of colon cancer. Fatigue or weakness. Weakness is a lack of muscle strength and a reduced ability to move your body, no matter how hard you try. Fatigue is a feeling of extreme tiredness or extreme lack of energy. Fatigue is the most common and least definitive of symptoms associated with colon cancer. Fatigue can happen if polyps or tumors bleed into the digestive tract, leading to a loss of iron over time and possibly iron deficiency anemia. A feeling of not being able to empty your bowels. Other common signs of colon cancer: feeling of not being able to empty your bowels. Tenesmus is a feeling of being unable to empty the bowel or bladder. It usually refers to rectal tenesmus, which can occur with inflammatory bowel disease, IBD, rectal cancer, and other conditions. Vesical tenesmus is a separate condition that relates to the bladder.